Today we learn something about burns. Channel's name is Heartbeat. My name is Dr. Amrit Kejriwal. Burns. These are a common cause of household injury and they are associated with skin damage, and that is what is dangerous into life. There are various causes such as scalding from hot boiling liquids, chemical burns, then you have the electrical burns, fires, flames, and excessive sun exposure. This can also cause burns. Now, coming to the classification of burns, depending upon the depth and effects, they are classified into first degree, they are classified further into second degree, third degree, and fourth degree. In this video, we will not be discussing third degree and fourth degree burns. In the first degree, you have the red non-blistered skin, and you can differentiate it from the second degree by having the second degree is blistered and thickened skin. So you can get the difference. If it's non-blistered, it is first degree. If it is second degree, it's blistered and thickened. Third and degree are more severe, and I'm not discussing that because household management of these burns is not possible. Coming to first degree burns. First degree burns, this is minimal skin damage, and these are superficial burns. Affects the outermost layer of the skin. Heals within 7 to 10 days without scar. There is associated redness. There may be swelling and pain. So the pain, if there's a pain, it's a good sign because it means that the nerves have not been damaged. And peeling of the skin occurs as the burn heals. Treatment. Soak the injury in cool water for 5 minutes. If you get pain, take acetaminophen, that's a painkiller, and apply cream aloe vera gel or lignocaine jelly over the burnt part. You can use an antibiotic cream also, and you have to cover it with a gauze. Please remember, don't bandage it, just cover it with a gauze. So we have to soak the injury in cool water for 5 minutes. If you get pain, take acetaminophen. You can apply cream, maybe something like aloe vera gel or lignocaine jelly. Use an antibiotic cream and cover it with gauze. Now if you have second degree burns, depth increases beyond the top layer and there is a formation of blisters. Skin becomes red and sore. Some blisters rupture and get covered with a coating. And bandaging is required. Usually heals in 2 to 3 weeks. Treatment of second degree burns. Run the affected area under water for 15 minutes. First degree burn is usually 5 minutes and for second degree burn it is 15 minutes. May require painkillers such as acetaminophen. You can apply an antibiotic cream and they may require surgical intervention. When to see a doctor? When the burn area is greater than 7 to 8 centimeters, face, hands, buttocks or groin are affected, wound is painful and gives an odor, when the patient has a burn and has associated high fever, when the person has third degree burn or fourth degree burns, and when tetanus injection was given more than 5 years ago. Any injury may require tetanus, especially if there is discontinuity of the skin. Prevention of burns. Keep children out of kitchen. When in the kitchen, the pot handle should be directed towards the rear of the stove. Keep a fire extinguisher near the kitchen. Test smoke detectors monthly. Lock up matches and lighters. Electrical wires to be covered. Harmful chemicals to be kept aside. And if you're going out in the sun, then make sure that you apply sunscreen regularly. Thank you for watching the video. Please do not forget to like the video. Please feel free to comment and subscribe to the channel and share link with your friends. Thank you once again.